we're going to go through a lot of information in a short amount of time. What we're talking about today is not necessarily clicking the buttons in the software. If you want to learn how to click the buttons in the software, be it 3Shape or exocad, go to our argen.com education website. We have free webinars that you can access. You can watch live ones or watch the pre-recorded ones, and they're updated all the time. So if you want to learn how to click buttons, I highly suggest going there. This is going to be more a foundational introduction into partials. Last year, when I came for the very first time to the Chicago show, I did a lecture on transitioning your labs or denture clinics into digital workflows and how that looks, how the clinical workflows look, how we can work with our dentists. The biggest feedback that I got was, I really want to do this, but nobody in my lab knows how to make a partial. Nobody in my lab knows how to make a denture. And so some of this foundational knowledge is kind of being lost as the really good removables technicians start to age out, start to retire, they're not working as much. And I know that for a long time the removables department was maybe not as cool as the crown and bridge department, but they're starting to see how invaluable this foundational knowledge is. So if you are a removables technician and you have some of this knowledge, I urge you to share it with the next generation, to start building up a new level of technicians that have a strong understanding of the basics. So that's what we're going through today. And we are going to look at some things kind of from a digital perspective, but it truly is just the basics. So we're going to go through how we actually want to make a partial, as in how we want to build the parts of a partial. So we are going to go through quite a bit today. Just kidding. There we go. And these are kind of the things that we're going to go through. This is going to be just a touch-up of these items. I highly suggest there's some really good textbooks available online. I read 4 original textbooks when I was making this. I went on a YouTube deep dive. There is so much information available. It's a lot of information, so it can be a lot to get through. So what we're going to go through today is honestly just your starting points on these items. So the first and most important thing that you want to be looking at is your data acquisition. I know working in a lab, working in removables, it can be difficult to get good data. It is okay to ask for a new impression. And if you get pushback, that's fine. Just ask every time. What are they going to say? Do your best. That's okay. Every time they send bad data, ask again. I need better data. Eventually, hopefully, maybe, they will start to understand that if we have good data, we have good products. So if we're looking at analog, what you want to do is check for voids, check for pulls. What this means is if the lab or the clinic is sending you an impression that they have already poured up, they have taken that impression off too soon. So that stone has now stretched that tooth. It's really obvious. You just have to look at your models and you'll see it looks unnaturally long and it looks like somebody pulled off that impression too soon. So that's a pull. So obviously if that tooth is pulled, now we're not going to be able to make an accurate partial, right? You want to also, something that not everybody checks is the palatal surface. If we're making an upper, we don't want, sometimes you'll get weird like overlapping of the impression material in the palatal area, especially if they're not confident in taking full arch impressions. They're more used to taking like a quadrant for crown or bridge. Want to make sure that you're capturing that full palate accurately, or we're not going to be able to like sit that partial on the palate. Now in digital data acquisition, you cannot make a partial with big holes all over. Yes, there are AIs that will fill the holes, but it doesn't actually know the morphology of the tooth. It's just filling it based off of an algorithm. So if we have a large void right where the guide plate is, now we're just filling it with AI. That's not going to be accurate either. So if there's large holes, ask for a new scan. You're not going to be able to make an accurate partial unless we're getting good data. Before you even get into designing your partial, as you're making your partial, I want you to think about some of the, like how we are actually treating our patients. So this is an acronym that I learned, and it stuck with me because I thought it was kind of funny. I like the word HEMP for this, so health. We are restoring health, comfort, quality of life. We are restoring aesthetics and phonetics. Phonetics is very important. We are restoring and improving mastication. They have to be able to chew and eat with this in their mouth. This isn't just to look pretty. This needs to be functional. And the most important one is preservation. Typically, if somebody needs a full denture, not every person with a full denture had all of their teeth pulled all at once. Typically they'll lose one tooth. They might get a partial. That partial might be made incorrectly. Now it's moving, it's pulling. Now they're going to move the anchor tooth that partial sit on. And then we're going to add to that partial in some weird, janky, welded way. Now we're putting pressure on another tooth. And slowly, over a long period of time, they're going to lose more and more tooth. They're going to get decay on these teeth, and now they're edentulous. So as we're making partials, we want to keep in mind preservation of the teeth that they already have. We don't want to make things worse for them. So with that in mind, we're going to jump right in. We're going to go through kind of all of the building blocks, what they can look like in terms of talking to your dentists, what they can look like in terms of talking to your lab staff. So the survey and blockout is your number one most important step when you're making a partial. You are now determining where your undercuts are for clasps. So if we have an undercut on the mesial of the tooth, our clasp approach is different. Our rest approach is different. The whole framework determines on where these undercuts are located and how we approach them. So it equalizes the retention on all of the abutments. We don't want one tooth to be holding on to all of the retention. We want all of our teeth that are holding this object to equally distribute that. And it minimizes the torquing forces, so that's what I was saying. We don't want one tooth to be torqued, because then we're going to lose that torque, we're going to lose that tooth, and then all of a sudden we have to add on to it and we're going into another tooth. So how many of you have actually used an old school surveyor? Some of you here. So some of you know how that works. That little plate on the bottom, it actually moves around. And you can angle this and set this. You're going to use all of these tools here to determine the best undercut, the best angle, and also use the wax tool to wax it up. Now the common mistake that I'm seeing in digital is you are still pouring a model, surveying it on your surveyor, drawing where you want your clasps, and then scanning it in. At that point, when you scan it in, how you survey it on your surveyor is never going to be how the software blocks it out. You can't actually align those two things. You have to block it out in the software. Because if you have drawn your clasps on the model, you bring it into your software and you're using the software to block it out and it's slightly different, where you drew your clasps may not now be where that height of contour is, where that undercut is. It might change because we can't accurately replicate the exact same thing. So when we're looking at it digitally, if we were to look down directly out the top of our surveyor, that is actually what that little blue dot is in 3Shape. It is us looking directly down our surveyor. So we can use this exactly the same as we would use an analog surveyor. And the information that we get is the same. It's just color-coded for us. So areas that are red are a super deep undercut. And it's all measured here on the right side. Typically, when you're going digital, a yellow undercut is where you're going to want to do the engaging. So anything yellow is where you want your clasps to be engaging. This is specific to 3Shape. Anything beyond that, you want to be blocked out with wax. Once we've blocked it out, we can still use our carving tools just like we would before, remove some of that wax block out, and allow room for that clasp to engage. We don't want to remove where the red and the orange block out is. We only want to remove where the yellow is, so we can actually come in and engage those undercuts. So guide plates, really quick. This is more when you're speaking to your dentist. Some dentists just don't prep guide plates. They should be prepped. When they're prepping the rest, they should be prepping these. And they should not extend beyond the proximal line angles. They should be nice and flat. What it's doing is it's allowing a surface for our partials to go up and down on. So these need to be prepped adequately. Otherwise, we just have this weird round surface that might have undercuts on it, and we're not making a good surface to slide these partials up and down on. Rest seats. So we're going to go through like what a rest seat should look like, what the shapes are, kind of what that area is. A little further, we're going to talk about where they should be placed as far as fulcrum and force, things moving. But first, we'll start off kind of what they should look like. So a rest, typically you want to rest so you can transfer all the forces. What that means is if you have no rest and you start chewing down, it's just going to go into your soft tissues. Because as you're biting, there's nowhere for it to go. So it's going to be going up and down on those soft tissues, and your clasps that are engaging your teeth, those clasps are now going up and down, torquing those teeth. So you need that stop so that when you're chewing and eating, it stops. It doesn't go down. So I'm only going over 3 really basic rest seats, and this is something that you can talk to your dentist too. If they don't really know how to make a good rest, it's really good that you understand what a good rest looks like, so you can have that conversation with your clinic. Because if they are constantly having partials that aren't working, that aren't fitting right, that are failing a lot, maybe you need to have a discussion how they're prepping the cases. So the occlusal rest seat. These are just kind of some of the basic information. Very, very basic. So you want it about half the width of the full intercuspal space. So however wide your cusps are, you want it about half that wide. Should be generally triangular and about 1/4 of that mesial distal tooth. So if you split it into 4 slices, 1/4. The positive seat is very, very important. Your seat needs to be driving the forces downwards. If it's sitting like this, it's going to slide. So the forces need to be going down. If they take one of their tools and they push on it, it should slide down in towards the tooth. That's very, very important for getting a solid rest. And then just for space consideration for the materials we're using, you should have about 1.5 millimeters of space from the opposing. With a embrasure rest, it's almost exactly the same, except for you're splitting it between 2 teeth. And you have to have a channel, because we need to be able to put clasps on there and put a minor connector in there, which we'll talk about in a little bit. So you have to have that 2 millimeter channel. You can't just have rests on the top, because there's no room for all the other stuff to attach to the rests. So a 2 millimeter wide channel is optimal. And then a cingulum rest, very similar. Most importantly, you have to have a positive force. It is a lot. There are some more in-depth things with this, but if you're just trying to get the basics across and you're trying to just have a basic conversation with your dentist, these are some of the key points that you want to hit. So, the clasp assembly. What we have is a reciprocating arm, a retentive arm, a rest seat, and below the rest seat, a guide plane. Every clasp assembly is made up of similar forces, even if it's an I-bar, which we'll talk about in a moment, or in this case, a C-clasp. Has all of the same components that make it a clasp assembly. The whole assembly has all these pieces. So, before we get into types of clasps, we have to talk about what materials do when they're in different shapes, basically. Our characteristics. If you have a uniform thickness clasp, it's the same thickness all the way across, it's going to be a rigid clasp. If you have a clasp that is tapered at the end, you will have more flexibility. If you have a clasp that is short, it will be more rigid. If you have a clasp that is really long, guess what? It's going to be a little bit more flexible. If you have a clasp that is really wide and thick, it's going to be rigid. If you have a clasp that's thin, it's going to be flexible. It's really important to know these things, when and where you want to use what for what types of clasps. Sometimes we need flexibility, sometimes we need it to be rigid. So knowing what types of designs will give you that type of clasp is really important. So if we're looking at a clasp here, I'm going to just grab my little pen. Here we go. I'm going to draw some things on here. So if we are pretending, this is not easy to see on, is it? Here we go. If we are pretending that this is our, say here's our height of occlusion here. Our clasp, because we want it to be flexible on the outside, should come down like this. We're going to talk about the undercuts in a second. And be a little bit tapered. The reason why we need it to be flexible on our undercut side is because it has to go around the undercut. So it can't be super rigid. It has to flex to get under that undercut and then go back to the form that it was in. So if we imagine this from a side view here, that little yellow area is our undercut. So our clasp is coming down towards the undercut. It needs to be able to flex around here and then lock in under the undercut. So in those situations, you don't want a short, wide, uniform thickness clasp. You want something tapered, something that's a little bit thinner, not too thin, so it can get that flexibility of material. Otherwise, it's going to be too rigid and it's just going to scratch the tooth. It's going to hold on too tight, cause forces that we don't want. Now, because we have a clasp that is bending around our tooth, that means that we're pushing forces onto that tooth. So if I was to put a clasp here, not there, here we go, put a clasp here, and just have a rest seat here, and then move on with my life, what are we going to do? We're going to be pushing that tooth. Every time that clasp goes up and down, we're pushing it away from where the force is. So what we need is something to reciprocate that over here. Something that does not flex. Something that is solid and rigid and will not flex. So when we're pushing, it's going to stop it. That's what your reciprocating arm is for. You have to have something to reciprocate that undercut force. Otherwise, your teeth are going to get torqued, and eventually they're going to fall out, and we're going to lead to a whole denture, right? It's the same thing when you're looking at an anterior tooth. We'll get into clasp design in a second, but if we're putting forces here and we're pushing on it, we still need something to reciprocate that force, something to hold it in. That can be a rest, that could be like an apron. If this is a premolar, that could be like another clasp. But on an anterior tooth here, typically what you would do is put a rest here, and it would not be engaging any undercuts. That would be fully blocked out. So the undercut is on this side, it's pushing, it's being reciprocated by something stronger over here. So for actual measurements and actual when we're designing, some key notes to keep in mind here. So a retentive clasp, when you're going digital, should not be any thinner than 0.7 millimeters. That is like the bare bones. I suggest going a little thicker than that, but you can't manufacture a printed partial under 0.7 millimeters. So when we're actually going into designing these clasps, the shoulder third will be above the height of contour. The height of contour is that line that determines where the undercut starts. The middle third can be right on the survey line. Now we don't have a survey line, we're not drawing this in pencil. Our yellow marker, our yellow undercut, that's our survey line. Wherever that undercut is starting, that becomes our survey line. So the retentive clasp part should be in the yellow. If you're going down into orange or red zones, that's too much retention. Now we have too much force. Our clasp can't flex enough to get into those deep of areas. The reciprocal clasp, the one that's holding on the back side, we don't want any retention on that. Those ones can be wide, those ones can be thicker, those ones can be shorter because we don't want flexibility. We want it to be rigid. And if we have a rigid clasp, we can't put a rigid clasp into an undercut because there's no flexibility. So for the reciprocating arm, you want it above the yellow line, and you can make it short, a little bit wider. It can be an even size. You don't have to taper those ones. An eye bar, again, this is just kind of basic design. We're going to talk a little more about eye bars and fulcrums in a moment. So the actual eye bar itself should be about 3 millimeters below your gingival margin. The actual foot that's engaging, the little part that's sitting on the tooth, about 2 millimeters long. And the part underneath has to be blocked out because, again, we only want to engage the yellow part of our undercuts, right? So the remaining part there, you can see, is blocked out. And that block out is based off of our wax block out from the very beginning when we did our survey. When do we use these clasps? If you're starting to look in textbooks, there's going to be so many different types of clasps, and they all have fancy names, and they all have weird letters associated with them. I don't think you need to know the name of every single clasp. I think you need to know, where do we put a rest, where's our retention, and where's our reciprocation. Do I need to know the name of every single clasp? Not necessarily. I know when you're talking with your dentist, an RPI clasp can be called 400 different things. So as long as you understand where is my retention, where is my reciprocation, and where is my rest, I don't think the names of all of the clasps are as important. We will go through some of the naming, and we're going to talk a little bit about why we put rest where and fulcrums. I know when I was researching more for this, and really making sure that I had a full, complete understanding before coming here and teaching you guys, I get to the part of the textbooks where it's like fulcrum, force, and my eyes glaze over. It's so hard to read through some of this sometimes. It's not as exciting as some crown and bridge stuff, but I'm going to try to make it as easy to interpret as possible. So, everybody's seen this drawing. We remember it from school. You have your teeter-totter, you have a force, and you have resistance. So what does that actually mean when we're looking at a partial? Wherever the rest is the fulcrum. Your rest seat becomes the fulcrum. The force is chewing, eating, speaking, anything that's causing that denture to move is the force. The resistance, what's stopping it from moving, is where your clasp is. So now you have this teeter-totter of force pushing down and resistance pushing up on the tooth. So when we push it down, or when we push it up, our clasp is moving. This is very exaggerated. If it is a tooth-borne, we have tooth on both sides, there is no fulcrum. It's not going to go up or down. So if it's the tooth-borne area, we don't need to worry about the fulcrum. This is only if it's a free end or no teeth on either side. Or sorry, one side. Teeth on one side, no teeth on the other side. So, if we have a rest that's on the distal of a tooth. So if you can see here where the triangle is, the rest is in the middle, the edentulous space is on the back, and the clasp tip is on the front. What's going to happen when we apply forces to this? So the rest, that red line, that has become our fulcrum point. So what happens at the fulcrum point, the clasp tip is going to go up. The edentulous space could go up or down. It's going the opposite, right? And what happens when we do that, we are now applying pressure onto that tooth. So how can we make things a little bit different? If we put the edentulous space and the clasp tip on the same side, opposite to your rest, just like you can see that little triangle, now when we move our forces, the clasp tip and the edentulous space goes the same direction. So we're not applying aggressive force to that tooth. We're balancing it out. So by having your edentulous space and your clasp tip on the same side, opposing your rest, which is your fulcrum, you're not going to be having that aggressive force. So what does that actually look like? If we have a case here, again, my mouse is hard to see on here. Here we go. So if we have a rest here, let's say, so we have a mesial rest. That means we want an undercut that is distal to that rest. That doesn't mean that we can't have a mesial undercut. It just needs to be slightly distal to where the rest is. So we can have our eye bar come in here, come up and around, and this is where our guide plate would be, right? So in this case, if we look down from the top, this is what would be referred to as an RPI. RP, that's terrible, PRPI. There we go. What that stands for is rest here, proximal plate here, eye bar here. RPI, rest, plate, eye bar. So if you're hearing the term eye bar or RPI, what they want is a rest with an eye bar and a proximal plate. Now in this situation, which on this image it's a little harder to see, what if we had our undercut when we surveyed and blocked out, what if our undercut is actually over here? What we can do, so that what that might look like is if our undercut, sometimes they look like this, our survey line, and it goes up, upwards like this. So we could still have a mesial rest, we could still have an eye bar, we can add a little wing to it, like that. That is now a modified T eye bar, or there is a modified Y eye bar. The reason that we're doing this is because we still want to have that support of our eye bar, but we want to get that undercut, right? So we can modify our eye bars depending on where our undercuts are. Now, what if we don't, what if they really, really, really want a C-clasp? And they really want to have not an eye bar. Maybe the tissue doesn't go low enough to bring it down that 3 millimeters. Maybe it's too visible, and you want to have something that can come from the distal. We are still going to do a mesial rest here, and we're going to do a clasp here with our undercut here. Now, when we're looking at our fulcrum, we have the clasp tip, the rest, and the edentulous space. The difference is we're not going to be using the same material. So we can change material to avoid the forces. We're going to use a wrought wire. By using a wrought wire, instead of the fulcrum moving the whole thing, the wrought wire itself is going to bend. So you can look at our fulcrum here. The wrought wire material goes down. Only the wrought wire. Nothing else is affected. That's why we might use a different, more flexible material in this situation. And so to do what this would be called is a RPA. RPA is rest, proximal plate, acromin clasp. An acromin clasp is typically a wrought wire. So if somebody's asking you for an RPA, that means they don't want an eye bar. They want a C-clasp made out of wrought wire. So what about minor connectors? What do the minor connectors do? Maybe we have our beautiful clasp assembly. So here we have our rest, here we have our proximal plate, we have our eye bar coming like this. We'll do that on both sides, rest, proximal plate, eye bar. So where is that fulcrum line? That fulcrum line is where the rests are. And your fulcrum line is not just on one tooth. That can be extended across your whole arch. You need to know where that fulcrum is across your arch because your partial can rotate on that line. So your fulcrum line for your whole arch is a line between your most posterior rests, so right here. That's our fulcrum line. We need to brace against that whole fulcrum line. We have braced against our one tooth with our reciprocating clasp. Now we have to apply that same knowledge to the whole arch of teeth. So we have to add a reciprocal element to stop it from rotating back and forth. To find where that needs to be, your reciprocating element needs to be perpendicular 90 degrees to your fulcrum line. To stop it from tipping, you need something to hold it up. Now you almost always want to avoid a singular rest on the centrals and the laterals. The roots are not deep enough. These are not stabilized enough. So if I was to just put one single rest here and use that as my fulcrum stop, that tooth eventually will get pushed out. You want to try your best to use a canine or a premolar. So in this specific case, we can put something on this canine, or if we wanted to, on this premolar. So now we know where our parts are, and a minor connector just connects the parts to the big parts. That's all it does. So minor connectors are just, where are my rests? How do I attach them all together? So here, we will put a minor connector here by this rest. We would put a minor connector here by this rest. And then we would get and decide where we want our major connector here, which I'll talk about in a moment. So now what you have is something that's fully balanced from those reciprocal forces, right? We don't have forces pushing down or back. We're stopping that with the clasps and with these extra rests. So when we're actually designing, again, some of the basics here. So when you're clicking the buttons, you know what to look for. The minor connectors should be joining the major connectors at a right angle. We don't want them to be angled. We want strength in those. They should be about 2 to 3 millimeters wide. They can nicely sit within the embrasures. That's probably the best place for them if you can. Just tuck them into those teeth. And they should be crossing the gingival margin of the tooth at 90 degrees. So finally, once we've decided where the rests go, once we've decided what clasp we're going to use, once we've decided how we want to reciprocate this, now we can piece it all together with a major connector. And again, there are hundreds and hundreds and hundreds of ways that you can make these major connectors. There's different names for all of them. I'm not going to go through all the different names, but 3 of the most common upper major connectors is a palatal strap, which that one is there. It's just a strap that goes across the palate. A palatal horseshoe, which is that little one in the middle, looks like a horseshoe, and an anterior posterior palatal strap, that one in the back. Now how do we determine which one we want to use? That's determined on how much space we have typically and what gap we're trying to fill here. So a palatal strap is typically 8 to 10 millimeters wide. So if we have way more space than that, we could do an anterior posterior instead. An anterior posterior, the straps, each piece of the strap is typically 6 to 8 millimeters wide. And there's typically, if you can, 15 millimeters in between those straps. That's why we can't always use an AP strap. We just don't have the space in the palate, right? So these, again, some basic rules for when you're drawing out your splines. They should cross the midline at 90 degrees. You shouldn't be crossing the midline at an angle. When you get to that midline, it should be straight across. Should also, again, like I said before, anytime you go across a gingival margin of a tooth, it should be straight up and down, right across at 90 degrees. And we want to avoid sharp, rigid lines. When you're drawing your spline, you want it to be in a natural shape. Curves, rounded edges, because in your mouth there are not hard, jagged angles. So we want this to feel as natural as possible. So to do that, make sure you're making it curvy and nice and smooth. You can still cross the midline at that 90 degrees, but you want it to have some softness to it. For the mandibular, same thing. Cross the midline at 90, cross the gingival margins at 90, avoid sharp angles. We don't want square anything. For the lower major connectors, again, I'm not going to go super in-depth today. We just don't have the time to cover everything partials. But what we have is the lingual bar. The lingual bar is pear-shaped. When we come into the digital setting, it's already pre-designed for you. In an analog setting, you have wax strips that are already shaped like a pear. The reason why is that when we're speaking and using our tongue, we don't have this weird square blob right on the back of our jaw, right? We want it to blend down into our tissue. So the lingual bar has to have 8 to 10 millimeters of space, meaning on your model, you have to have that much space between your gingival margin of your tooth and the depth of the sulcus. And we'll get into why in 1 second. Now, why you would use a lingual plate Couple of reasons. One, you might not want to put rests on individual teeth. So if you just have 4 anteriors left and you don't want to torque one of them, put a plate across the whole surface of all of those teeth. That acts as your reciprocator for your fulcrum. Also, if you know that this patient might lose another tooth soon, it's nice to put in a lingual plate so we can add more onto it. It is difficult to add to a lingual bar. It's really difficult to weld something on that's going to be strong enough to hold those forces. And typically you should be remaking a partial. So if you know within the next 6 months that they're going to be losing another tooth, a lingual plate is better so we can add onto it with structure. So what we went through here, really, really basic intro. We went through guide planes, rest preps, clasp assembly, major minor connectors. So we're going to draw out some designs together based off of all those principles that we spoke to. I have about 6 cases here. I'm going to walk through the thought process, how you approach that. If you're going fully digital, what I like to do before I design a case is actually take a snapshot, like a screenshot, bring it into Paint, and just start drawing on it. And then while I'm drawing my splines, I can remember, oh yeah, I need this here, I need this there, and I'm not trying to think of it as I go. I'm designing it before I actually start designing it. So we have some cases here. So here we have a distal free end, meaning we do have a fulcrum. It's not locked in between 2 teeth. So we have a case that's going to rotate, right? How would we approach this? Depends on where your undercuts are. How do we know where our undercuts are? Depends on how we survey it. So if we have surveyed it and we have found that we have nice, here we go, we have nice mesial undercuts over here. This is exactly how I go into a case every time in Paint. I just draw all over it and I keep that image before I go and click the buttons and design this. So we have a nice mesial undercut, right? That means to get that fulcrum, I want the clasp tip, the edentulous space on the same side, right? So I'm going to go with a mesial rest here. I'm going to go with a mesial I-bar. So it's going to engage here. And when you draw an I-bar on the paper, it kind of looks like this big S here, like this. And a proximal plate. Same thing here, mesial rest, mesial I-bar, proximal plate. Great. We have our 2 main clasp assemblies. Where do we go from there? We need to reciprocate those, right? We need to reciprocate that force, so it's not pushing. So that rest has to have a minor connector connected to it. It can't just be nowhere. So these rest seats, the minor connectors are going to come down here. One here and one here. Those are going to cross the gingival line 90 degrees. They're going to be 2 to 3 millimeters wide. They're going to connect to our major connector at 90 degrees. From there, I can draw out where my fulcrum line is. So I know that the fulcrum line is that line across your 2 most distal rests. So that's these, there's only 2 rests on this case, so that's here, somewhere there. That's my fulcrum line. Now I need to reciprocate that force. So to reciprocate that force, I need something that goes perpendicular to it like this. I don't want to do it on these 4 anteriors. So depending on space, if you have the space, a premolar is typically better. It's wider tooth, it's rooted into the bone a little deeper. If you don't have the occlusal space, a cingulum rest is always good too. So let's say for this one we have cingulum rest, so we'll do a rest here. We'll go back to our black marker actually. We'll do a rest here. We'll do a rest here. And now we have our fulcrum reciprocated, right? So what about the major connector? We need the major connector for a lower here needs to be 6 millimeters from our gingival margin. And it needs to be 6 to 8 millimeters wide. That is why you need that full amount of space, right? So let's say we have that full space, we have that full depth, we have lots of room, then we're going to do a lingual bar. So then our lingual bar would come in here. We would attach our minor connectors here. And then lastly, we can decide where our mesh goes. This is exactly how I would do this. And then I would come into 3Shape, come into exocad, click all of the buttons, make a nice beautiful design, following some of those guides that we spoke to before of minimum thicknesses, minimum heights, following kind of all those guides. But deciding where these parts need to be is almost the more difficult part. So what about a case like this? Well, in a case like this, we don't actually have a fulcrum, so we don't have to worry as much about those reciprocating forces because we have tooth-borne on both sides. Tooth-borne cases are a little bit easier. So when you have a tooth-borne case, you can just do a rest here, a rest here, a rest here, and this one here, you could either do an I-bar, depending on where your undercut is, or you could do, because it is tooth-borne, a little C-clasp here, because it's tooth-borne. Now, just because it's tooth-borne doesn't mean we can just not think about the future. What is the prognosis on those two back teeth? Are they going to be falling out soon? If so, we maybe should plan for the future of that. Maybe we should be reciprocating this a little bit more, knowing that those two back teeth are going to fall out. If not, if they're stable and we feel like this is going to be lasting a long time, then all we have to do is a little C-clasp on each of these areas. Let me just get my pen back here. So we would have a C-clasp here with the reciprocating arm, a C-clasp over here, here with the reciprocating arm, a C-clasp here with the reciprocating arm. All of those would have a proximal plate, proximal plate, proximal plate, and proximal plate. This one here, if we're going to do a C-clasp, has to be connected to a rest, right? That rest becomes our reciprocating arm. Now the major connector, maybe we do not have enough space. Maybe this is not a deep enough tissue. It's really shallow. We can then, instead of resting this, just do a plate across here. Plate, plate, plate. This mouse is not working the greatest, guys. Come across as a plate and then come down. And when we're plating it, again, we're protecting for the future. We can add teeth onto it. It's acting as a reciprocating element in case they lose those back teeth. And we don't have the space for a lingual bar, so we can make adequate thickness by plating it. When you're plating it, you can still blend it into the teeth nicely. You can still have a nice cleansable partial. It's not bad to plate your partials. If you don't have the space for a lingual bar, you can't squeeze it in there. Some people's lower jaw isn't made for a lingual bar. And then you would go in and do your little mesh, do your little mesh. So on this upper, we would approach this exactly the same as we would before, but maybe they don't want I-bars, maybe they want C-clasps. And if they want a C-clasp, remember, to break that force, we're going to use a wrought wire instead. So, oh, just kidding, go back one. We would have our rest here, just kidding, we would have our rest here, we would have our rest here, and we would have that C-clasp come around. That is our wrought wire, right? Our C-clasp. And to draw a wrought wire, like if you want to draw it on a prescription, then you draw a little line here. Then we know that this is a wrought wire, like this. A wrought wire here, do, 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 do. And then our reciprocating element on this side. Now, when it comes to the major connector, that depends on your space. So if we have enough space here, we can do an anterior-posterior palatal strap. So what we would do is draw it here in the back. This has to be 6 to 8 millimeters wide here. This is 6 to 8 millimeters here. Draw another one in the front. 6 to 8 millimeters here. 15 millimeters here. Now when we're drawing it in the actual software, we want it to be soft, curved lines, crossing the midline at 90 degrees, natural shapes, nothing harsh, nothing aggressive. We want this to be a nice, clean framework. Something like this here, we still have a fulcrum, but it has now moved kind of at an angle. So our fulcrum would be, depending on where we put our rest seats, say if we put a rest seat here, and we put a rest seat here, now our fulcrum line is here, across, right? There. So if we want to reciprocate this fulcrum line, has to be perpendicular. So that's actually going to come this way. So now we know we need to reciprocate it on that side of the arch. It has to be perpendicular to the fulcrum. So now we know our reciprocation for this whole object should be on this side, meaning we can put a rest here. This rest here on this side, between these two teeth, these two can just be like this. And now we know we can have our minor connector here, we can have our proximal plate here, we can have, depending on how we want to approach this clasp, we can do a C-clasp here with our reciprocating, C-clasp here with our reciprocating, and here depends on where our undercut is, depends if we want to do a Rottweiler. Let's say we do an I-bar here, so we're going to come out, in, have our reciprocation here with our minor connector. Here we could do a palatal strap instead of an anterior posterior or something similar. Again, we want to make sure we're using nice curved lines to approach this, coming across at that 90 degrees, and then we can draw in where our mesh is. So when you get into, the actual clicking of the buttons, you want to keep in mind all of the minimum thicknesses of your whole frame. If you're getting into SLM printed or even milled, it's a little bit different than when we're casting wax. You cannot go below that 0.7 millimeters. So if that's your thinnest, if you want a flexible clasp, remember we said has to be tapered, has to be thin, has to be non-uniform in shape. So if 0.7 is your thinnest point, then the top of your clasp should be a little bit wider than 0.7. And finally, something like this, there is no fulcrum line on a case like this because it's completely tooth-borne. That doesn't mean that we can just do a unilateral partial. We still need to brace it across the whole arch. So what you would do in a case like this, unfortunately, this little guy in the middle would get a rest on this side, a rest on this side, a rest here, and we could do a rest here. So this case here, we could either do a little C-clasp because we're not worried about that fulcrum because there's no fulcrum line, right? It's all tooth-borne. Here, we can do a C-clasp. Now this one in the middle, we could just do it as rests with minor connectors, depending on if that tooth's going to come out. It is rare to see kind of a floater in the middle. Sometimes we might just plate it to just hold it in place. We don't necessarily need to do a C-clasp on both sides. We could just do a plate like this, because we still have that rest on this tooth and this tooth, right? So that one in the middle doesn't necessarily have to have a rest on both sides. We could plate it just to hold it in place. Now when we're looking at our major connector, we need to have something reciprocating on the other side. This is typically when you would see an embrasure clasp. This is when they need to be prepped properly to get that minor connector space in there. We need that 2 millimeter channel on both sides. Otherwise, we're not going to be able to put the clasps on. We're not going to be able to put the minor connector on. So on this side here, where's my pen? There we go. Maybe we'll do an embrasure rest here. So this is where you need that 2 millimeters all the way around, right? So this would be our rest. That's a very aggressive rest. And we'd have our minor connector coming down here. Our retentive clasps would be here, retentive, retentive. To reciprocate that, we would put this here. And we can draw some kind of major connector that would connect over here. So something like a weird palatal strap. On a case like this, I'll be honest, I haven't seen too many of these, and when you're getting into designing frameworks, I urge you to go online and look at some of the masters who have made YouTube videos. They have a lot of creative ways to make a nice major connector. I don't really think that every major connector has to have a serious name. We're just connecting the parts, right? So it doesn't necessarily have to be called a strap or a horseshoe. If we're designing our own cases, we just want to be nicely connecting all of the parts. So there are a lot of creative ways to make this more organic, to make this more flow when you have weird shapes like this, right? So I do highly, highly, highly encourage you, if you're going down this route, please go on YouTube, read some of these textbooks, and understand more of the design. This whole presentation was to understand that when we're going into this, it's not just about how thick is the clasp, how thin is the clasp. It's about understanding the forces when we're balancing out a case. If we're not balancing out our cases, what we're doing is we are now not preserving our teeth, right? So if we're not preserving our teeth, they're going to end up in a denture. And that is not the goal of giving someone a partial. A partial should not be a holdover to a denture. A partial should be a restoration that our patients can speak with, eat with, laugh with, function with for a long period of time. Maybe they can't afford a crown, they can't afford an implant. That doesn't mean that we lead them on a path to a denture, right? So we need to understand what these forces are doing and how to preserve the teeth and how to preserve their function. That is all I have for you today.